but we can bypass the liver. What the liver does, it adds an OH group, hydroxyl group to vitamin D to put it into the blood.
This is the calcidiol
That's
blood
right.
storage form.
Yeah, absolutely.
Yeah.
But we can give that form by mouth.
Well, why on earth don't we do that every time someone gets an infection?
Yeah, because that part activated form, the calcidiol, that is absorbed into the blood within about 2 hours. Whereas it will take up to 2 weeks for the raw form of vitamin D to become activated or pod activated. The calcidiol, it takes 2 hours.
So we have an immune optimizer
Yeah,
that goes into the blood within 2 hours, and that is working one heck of a lot quicker than antibiotics,
It is
which are going to take,
yeah,
even IV, they're going to take 4 or 8 hours
yeah,
to work,
yeah.
and that's going to work, and then the cells can use that straight away. The white blood cells could use that essentially instantly.
Instantaneously, yeah.
So we could be getting the immune system really roaring into gear
Yeah,
in my septic patients
Yeah,
within
yeah.
2 or 3 hours.
yeah, absolutely.
And yet so what we have in emergency departments, we have something called the Sepsis 6.
Yeah,
So we get them in, and you've got to tick them all off, and it's got
Yeah.
to be done within an hour, rightly.
Yeah.
So first one is oxygen.
yeah,
The next one is IV antibiotics.
yeah,
The next one is checking lactate. I might be out of order. Checking lactate and hemoglobin.
yeah,
Intravenous fluid resuscitation.
Yeah.
Checking the urine output. And I may have one other one I've forgotten. But really, we should change that from the Sepsis 6 to the Sepsis 7 then. We should be giving
yeah,
calcidiol.
I'm sure.
Because all of those things that we're doing, apart from giving the antibiotics, not really affecting the infection. It's just monitoring the body's response to the infection.
Yeah.
It just
Antibiotics won't work if the immunity is no good. We've got to have immunity. Antibiotics are very useful, obviously, very, very, very important. But the immunity system, the natural immunity in the body, is of vital importance, and we've got to make sure it's optimal, that it's working properly. And the thing that keeps it from working properly is vitamin D deficiency. Now, we could come on to, you mentioned coming to hospital seriously ill. And the other thing is, one thing that makes you seriously ill is having an operation, quite honestly. A major operation means you're temporarily seriously ill.
Yep.
And you've got to get over that operation. And that requires defensive immunity as well. And it's been well worked out that post-operative complications are more common in people who are vitamin D deficient. So, preoperative check when you go into hospital, pre-op check should include a vitamin D level of the blood.
But it
For
doesn't.
a major operation.
I mean, why is it? Yeah. It's so obvious.
It is indeed. Yeah.
Well, why haven't the health authorities worked this out? I mean, it's
You and I believe in nature.
the created
And we've
order.
got to believe in nature.
Yeah.
We've got to optimise our natural immunity.
Yeah.
And we know we're all vitamin D deficient. We know we work indoors, not in the fields. We know we have a lot of clothes cover. We know we've got a lot of cloud cover. We know that half our year is we don't produce vitamin D because it's winter. We know all these things. Let's put it all into action. There was a photograph in the newspaper last week. It was of a little Afro-Caribbean, Black African ethnic child. And it said he was to illustrate a finding that's come from the paediatricians that ethnic minority children have a much higher complication rate after they've had their appendix removed. They're slow to recover, more complications. Why is this? Is it something to do with racism? Well, it's glaringly obvious.
Yeah.
It's glaring. We know very well that these children from ethnic minority backgrounds are born deficient in vitamin D. We know that
probably deficient when they were a fetus.
Yeah, absolutely, yeah. We know very well that vitamin D is essential for optimising immunity, And we know that post-operative complications are more common in people with defective immunity, and also in people who are vitamin D deficient. We know it all.
Let me see if I can work this one out. It's just so obvious.
It is indeed.